Okay, I think we should probably go ahead and get started. Welcome to this colloquium. It's exciting to have you all here today. My name is Susan Zahner. In case there's somebody in the room who doesn't know me, I'm the Associate Dean for Faculty Affairs and professor here in the School of Nursing. And I'm delighted to introduce this topic, which is really about connecting practice and research and what the kinds of resources we have available here in the School of Nursing, some really fairly innovative programming that we've been doing to try to connect School of Nursing faculty, staff, and students to community groups that are interested in our work, and we are interested in helping them with their work in communities. So welcome to everybody, and it's going to be sort of a quick-moving panel presentation of people. Sorry, this went off. So I'm sure you can all keep up with this. I want to start by just referencing our School of Nursing strategic plan, and this session today kind of links to our strategic initiative number 2 of this list. This is a list of 4 strategic initiatives that we had, and one of those was the second bullet point on here, which is facilitate and improve nursing education in practice settings, improving academic practice partnerships, improving and supporting faculty practice and research, and contributing our expertise and resources to practice and to health improvement. So these are our initiatives. These are strategically what we're trying to do as a school. And the types of programs that you're going to hear about today are evidence of that strategy. They're things that some of which started before we had the strategic plan, but are part of our school's ongoing effort to do these kinds of things in partnerships, facilitating research, facilitating practice and research, and really contributing our expertise to the community. So what we're going to talk about today are these 5 collaborative programs, and this sort of just shows a little bit of a sketch about how they fit in the school's structure. So some things are part of the nursing research and sponsored programs area, and that's this ICTR. You've probably all heard of ICTR, the Institute for Clinical and Translational Research, and that the division of that big overall program that's related to community engagement. So that part, and then from part of NRSP also is the Wisconsin Network for Research Support, or WINRS, which you'll hear about. But some of these things have been started through the initiatives of faculty members. The Wisconsin Public Health Research Network is a network that was started by me and colleagues in public health in the state. The Healthy Learner Collaborative was initiated by Lori Anderson and school nurses and school personnel in the state. And then the Center for Aging Research and Education is really an initiative that got started with Barb Bowers and many others in the aging area. So these are the 5 programs that we're going to just touch on today. And we want you all to know about them because there are opportunities for faculty and students and people in practice to join with these efforts if they're of interest and can help contribute to your own practice or to your own research or to your own studies. So there's opportunities throughout all 5 of these areas for you to be engaged. So why do we think you ought to be engaged with these groups? These are all examples of ways that research and practice are trying to work together, to collaborate together. So it helps to break down those traditional silos between research and practice. So that's one good reason. It's also a way of building relationships and getting to know other people in the school and in the community that touch your areas of interest. So be that public health or be that aging, so on. So it's also, these groups allow faculty to contribute their expertise in various ways, as well as students having opportunities for students to contribute their expertise to these areas. These are all also groups that can, if you're a researcher or a student researcher, can help you find and engage with populations of interest in your research. So there are ways of doing that. And there are also groups that are involved with disseminating the work, disseminating the results of discoveries from research that's done here. So it's sort of community engagement, and it's also dissemination activities. So I'm going to stop sort of the overview and turn it over to Sharon Schumachers, who's going to get us started. Feel free to use either mic.
Thanks, Susan. All right. The National Institutes of Health support a national consortium of more than 60 medical research institutions, including the UW Institute for Clinical and Translational Research, also known as ICTR. ICTR's goals are to accelerate the process of translating laboratory discoveries into treatments for patients, train a new generation of clinical and translational researchers, and engage community health stakeholders in translational and outcomes research. The School of Nursing is one of 5 partner schools of ICTR. The other schools are the School of Medicine and Public Health, the School of Pharmacy, the College of Engineering, and the School of Veterinary Medicine. School of Nursing investigators, research staff, and students are involved and benefit from the following ICTR programs. ICTR's pilot grant programs that fund basic discovery research, patient-based clinical research, patient-centered outcomes research, dissemination and implementation research, community-engaged research, and the discovery and development of novel therapeutics. Since 2008, several School of Nursing researchers have received ICTR grants, including Barb Bowers, Betty Kaiser, Barb King, Diane Lawver, Audrey Toulousek, Gay Thomas, and Erlise Ward, to name a few. ICTR's patient-centered outcomes research resources include pilot research grants, toolkits for successfully engaging stakeholders and patients, and for forming and sustaining stakeholder panels, training activities, and opportunities for research collaborations. ICTR's Client Services Center offers consultations and resource referrals for early to mid-career investigators. There are consultants who can help you with community academic partnerships, biostatistics and biomedical informatics, research education and career development, possible study sites, scientific manuscripts, grant applications, research project management, and compliance reviews and monitoring. ICTR's Clinical Trials Network. ICTR facilitates research within established networks in Wisconsin, across multiple states, or within specialized communities. ICTR's academic programs include career development awards, graduate programs, certificate programs, and mentoring resources. One of the ICTR certificate programs is administered here at the School of Nursing by Barb Bowers, Caitlin Schwabeck, and myself. It's the Certificate in Clinical and Community Outcomes Research. Several School of Nursing students and faculty have earned this certificate, including Barb King, Andrea Gilmore Bykowski, Kristen Pekanik, Mai Chu Lor, Tolu Oyesanya, Anna Krupp, Ann Roll, Elise Knudsen, and FEU. ICTR also offers several non-credit workshops throughout the year. So to receive grant and workshop announcements, go to the ICTR website and click on subscribe to our list. It's at the bottom of the page. And for a free research consultation, go to the ICTR website, click on Research Resources, then click on Research Resources Overview, then click on Request a Research Consultation, fill out the online request form, and after that, someone will contact you within 3 to 5 business days. Okay, so next, we're going to hear from an indisputed winner, Betty Kaiser.
Thanks, Sharon. I'm Betty Kaiser, and I'm with the Wisconsin Network for Research Support, also known as WINRS, and I'd like to acknowledge my colleagues Gay Thomas and Caitlin Schwabeck. So WINRS is a patient and community engagement resource. What does that mean? It means that we help researchers get patients and the public involved in giving input on research. If you develop materials or programs or research that involves people, then you can benefit from patient or stakeholder engagement. So here's a quick history of WINRS. We started in 2010 with a 3-year NIH grant. Thank you, Barb Bowers. And the purpose of this grant was to develop a community-based infrastructure to support health sciences research. One of the first products from this grant was the creation of 2 unique community advisory boards. These are the Community Advisors on Research Design and Strategies, also known as the CARDs. The CARDs are lay advisory groups based in Madison, and these groups meet monthly with researchers to provide feedback on public-facing materials. The CARDs give amazing feedback on how to make materials of all kinds more inviting, easier to read, and easier to understand. Oh, I guess we should. How about that? Our NIH grant ended in 2013, but we transitioned WINRS to a fee-for-service resource still based here at the School of Nursing. So we've sustained the CARDs for 8 years. And the consultation business that we've grown here at the School of Nursing is grounded in what we've learned in these incredibly productive 8 years with the CARDs. So we provide an array of services that we tailor to meet your needs, and we work hand in hand with you to make sure that you get the outcomes that you want from stakeholder engagement. So I'm going to describe a few of our services. We plan and facilitate CARDs meetings, and we take care of all of the logistics for these meetings and provide a comprehensive report to you after the meeting. We review and advise on stakeholder engagement plans for grant proposals. We've reviewed hundreds of proposals in the past few years, and we can help you think critically about your engagement plans and make sure that they fit your budget, your time frame, and your project team resources. We can help you develop successful strategies for recruiting and retaining study participants, and our particular passion is helping to recruit participants from underserved communities. So we can help you recruit people for your studies, or if you want people as stakeholders on your projects, we can also help with that. We are big believers in providing any kind of stakeholders with an orientation to the work that they'll do on your project, and we can work with you to develop a tailored orientation. This is one of the most important things that you can do to make sure that you get the outcomes that you want from engaging stakeholders in your work. We also provide ongoing coaching across the length of a project to make sure that your stakeholder engagement is effective and productive throughout your project. As an example, we're working with Jillian Baden and Barb King on one of Dr. King's projects right now, and we're helping them with ongoing planning for their patient advisory council meetings. Finally, we can help you with evaluating what it's like for stakeholders to work with you. We've done a number of evaluations of the stakeholder experience in research, and we can help you find out from a stakeholder perspective what has worked well, what could be better and what could you implement in your current project or in future projects. So I just want to list a few people that we've worked with at the School of Nursing over the past few years. Jillian and Barb King with Dr. Bowers and Kim Nolette on their e-care project. We've worked with Kim Whitmore, Diane Farcetta, who works with Kim and Barb, Andrea Gilmore-Bukowski, Lisa Bradsky, Audrey Toluchek, Diane Lawver. I saw Diane come in, was one of our very first visitors to a CARDS meeting, so she was with us way back when. Ann Ursig, we're working with Ann, and we've also worked with really a wide range of PhD students. Recently, we worked with Chen Chen, Heidi Lindroth, and Tolu Oyesanye. So if you're thinking about using our services, please contact us, and if you're applying for a grant, contact us early so that we have plenty of time to put together a really robust stakeholder engagement plan for you. And finally, I want to finish with just highlighting a few of our resources. Please visit our winners website. Oh, that's the tail. I've been behind on slides the whole time. I'm sorry. There we go. Please visit our winners website. There's a resources tab on the website, and you can find info there on our published papers and links to some stakeholder engagement toolkits that we've developed and that are free for download. Watch for our newsletter. We hope you're already avid readers of the Winners Wire, and there will be another issue coming out in March. We always include lots of examples of stakeholder engagement in the newsletter. We list some resources for researchers. If you go to our website and look on our blog, you can find archived articles from previous newsletters. And we would love more Twitter followers. We try to post and repost interesting resources, and we'd love to follow you. So please come talk with us. Contact us. We would love to work with you, help you bring your materials to a CARDS meeting, help you think about developing an engagement plan for your research. So we look forward to hearing from you. And next up, I believe we have Susan.
Great. So I'm here to talk about the Wisconsin Public Health Research Network. So this is a public health practice-based research network, and the term practice-based research network goes back quite a number of years. It was sort of started in the primary care area, where they linked primary care practices together to be able to recruit and do research across many different practices in a given area. So that's kind of where it came out. It came from initially, and so our network is really focused on trying to link and support public health practitioners and researchers who are interested in public health practice to answer questions and to disseminate discoveries that are really applicable to improving public health practice and to improving population health. So it's really our goal overall is to increase the amount of research that's done that's directed towards improving public health practice and improving population health. We've sort of taken the health services research methodology and emphasis, which is really about improving health services, and applied that to public health settings. We currently have almost 300 members who are part of our network. About half of them, a little over half of them, are from local public health departments or the state public health department here in Wisconsin, and the rest are researchers in our academic institutions in Wisconsin. The UW-Madison, Marquette, Medical College of Wisconsin, and UW-Milwaukee predominantly. And we also have students who are part of our network. We have a steering committee of individuals who are about half of which are from public health practice and the other half are researchers. And we meet on a 3 to 4 times a year basis to try to guide and promote the activities of this network. Sue Kumperman, who's the director of public health from Wood County Public Health Department, has been the co-director of the steering committee along with me really since we started. So we started in 2009, and it was started with funding from the Robert Wood Johnson Foundation. And RWJF had a special initiative to try to increase the amount of public health services and systems research that was going on across the country. So we were in a second round of grants from RWJF to create these public health practice-based research networks and to demonstrate that research could be done that would be facilitated by these networks. So some examples, so we did that, and in our first funding through Robert Wood Johnson Foundation, which lasted about 3 years, we did a number of projects to sort of demonstrate that we could create the network, we got it started, and so on. And then did a study that was actually about community health assessment and community health and action planning. So we collected those community health assessment plans and developed a rubric to judge the quality of those plans and really what should be in those kinds of community-based action plans. So that was the first study that we did. Since then, there's been a number of studies that have been done in collaboration with the network. I would say not sort of exactly done by the network, but different researchers using the network to help facilitate their research. We've looked at cross-jurisdictional shared service arrangements. We've looked at integration of primary care and public health, and that study was actually done in 4 states using 4 primary care research networks and 4 public health practice-based research networks. We also looked at interorganizational collaboration and its impact on volume, reach, and cost of communicable disease services. That was a study that was also run out of the University of Washington and also engaged 4 state networks across the country. We did a survey looking at the future of teaching in local health departments, and that was done across 3 states and was led by someone from Ohio. And then I mentioned the Community Health Assessment and Planning Project. And there's been a few other smaller projects as well. So the network is now, we sort of ended the RWJ funding, and we had a little gap there in funding where I just kind of kept it going here at the School of Nursing, but it's now funded through the ICTR CAP program. So it's one of the initiatives that ICTR CAP supports for its community engagement function. So really trying to make sure, or to use the network as a linkage to the official sector public health folks, public health practitioners around the state. So that's how we're funded now. I want to point out Tracy Morochek. Tracy has been the project manager for this for quite some time, 5 years. And unfortunately for me, Tracy is moving on, but she is going to be full-time here in the School of Nursing, working with our continuing education and nursing program. So she's still here. She'll be great. She is great in that role. But her work on this network has been very, very valuable to the network. She came out of a public health practice herself, and so had some really good contacts around the state. So I just want to thank you, Tracy, for all the work you've done on this. So there's a position open right now that I'm recruiting for, just in case. Another way we've helped staff the network is through a program that we've called the Translating Evidence to Practice in Public Health Internship Program. This was a donor-funded program for the School of Nursing, and we've been able to have some students do internships with the network. And Katie Mead and Carly Babino, I saw Carly here. Carly is currently our intern, and Katie Mead is a recent intern. So it's been a hopefully good experience for them as well. So just to close, how might you benefit from participation in the network? First of all, if your research has a connection to local public health practice or state public health practice in Wisconsin, it's a good linkage for you, providing access to those well over 100 public health professionals who are part of this network and who are interested in public health research because they've signed up and they're part of this network. So access to state and local public health professionals. We've been able to use the network to find people willing to serve on advisory committees, advisory groups for research programs. It's also an opportunity for dissemination. We have a website that's part of the School of Nursing website under that outreach tab. and you can find out lots of information about the network there. So we disseminate information through our website, through our listserv, which is really the membership, all right? I mean, this is free, and if your name is on the list, you're a member, right? So it's not hard to be a member, and you can all be members. And we also push out information about news, about funding opportunities in public health practice, about new discoveries or new papers that come out that are relevant to public health practice. We also early on created a list of about 80 priority research questions that local public health people had about this type of research. So that's a place you could go and look for research questions that need answers, and that's available through the website. And then I also mentioned that we do sort of curate for funding opportunities that would be relevant for public health type of research projects. So that's what I have to say about the network, and I'll turn it over to Lori Anderson.
Thank you, Susan. I'm Lori Anderson. I'm a clinical professor here, and my area is pediatrics and specifically school health. And so I want to just make you aware of a group that we have called the Healthy Learner Collaborative of Wisconsin, and just give you a little background on it and what we do, and let you know how it could work in your research if you're interested in pediatrics. So I always say that this group grew organically, and that's sort of literally true because I bumped into one of the founders. She and I met in the produce department at the grocery store years ago and started talking about how it would be really nice to get the school together, academics together with school nurse practitioners, and then also include our the other sort of arm of the triumvirate, the people at UW Health, the nurses there who are caring for children in school. And so our focus was really looking at children who had chronic health conditions and how we can communicate, how school nurses can communicate with people in the clinics and with parents. And so that was sort of our goal and our focus. And what we've grown into is a larger group. We started, I think, also about 2009 or so, 2010. And now we have representatives from throughout the area, the K-12 schools. So we have school nurses who are part of our group, and then healthcare organizations. So we include nurses who are at the specialty care clinics at American Family Children's Hospital. And recently we've expanded to the primary care and pediatric clinics. So trying to think about how, this is nursing, how we can get our nurses to talk to each other. And then we have some folks here from the School of Nursing. Tracy Snedden is going to be taking a leadership role in this organization next year. And we also include Roberta Pollack from Edgewood. So again, also like a lot of these groups, it's not exclusionary. So if you're interested in participating, we'd love to have you. So our goal is to improve health and education outcomes of children who have chronic health conditions. And what got us going back in 2009 was something called the Healthy Learner Model. And this was developed through a large grant given by the American Lung Association to the school district in Minneapolis, and they were interested in improving outcomes for children who have asthma. And so this model was developed, and it really was sort of a community-wide model that included schools and clinical practice sites. And so we based it on that, and one of our very first meetings we brought in, I guess it was 2010, we brought in two of the nurses, the head of school nursing in Minneapolis and in St. Paul, and they came in and talked to us about their experience with this Healthy Learner Model and how important it was to have this sort of cross-communication. And so that got us, really excited about the prospects here. And so we have been meeting on a monthly basis since then, and most of our focus has been getting people together and talking and knowing who to contact when you have questions. So our next event was called Curbside Consults, and we brought in nurses from the specialty clinics, so the nurse who is in the diabetes clinic or the neurology clinic, the asthma and allergy clinic. And we had the school nurses come in, and they just rotated around and asked their questions about the kids. And so they had a chance to get to know each other, and people in the clinics got to hear what's really going on in the schools and vice versa. And one of my favorite stories about this event was there was the neurology nurse who had worked with a school nurse. They'd worked for 20 years together over various students over the years, but they'd never met face to face. So they had a chance to sit down and see what the other person looked like. So, sort of forming these relationships was really an important part of this. Another event that we did, and these were annual events, was collaborating for student mental health. Of course, mental health issues are a really big issue in schools, and we continue to hear that this is needed, so I imagine this will be something that we'll offer periodically. But we brought in experts from the university and then also from the schools, and they presented, and then we had small workshops and people could get together and speak. We did a pediatric grand rounds, so we've done a lot of preaching to the choir, to nurses who know what we need and what's important, but we thought we needed to get out there and talk to some of our physician colleagues. So we did a pediatric grand rounds on on school health and also what this Healthy Learner Collaborative is. I'm trying to think a little more broadly. Growing the partnership, this is where we really brought in our clinic nurses, our primary care clinic nurses, and got their opinions on how school nurses can contact them or how they want to contact people in schools. And then our last event last fall in October was Healthy Nurses Supporting Healthy Learners, and we were kind of going off of the American Nurses Association, sort of health for nurses, and so we brought in a speaker to help sort of a mindfulness approach personally for the nurses, and then also had some speakers on opioids and LGBTQ issues. So those are the big events that we've done. This is a group that is, we don't have any major funding. We're supported through American Family Children's Hospital, who provides meals and some administrative support when we have our events. So it's, like I said, it grew collaboratively, but the thing that's, I think, for future researchers or current researchers is sort of the power of relationships. We're trying to build that amongst the folks who come to our presentations, but just you as a researcher and the relationships that you form with folks in the community can be very powerful. So there's a great network now of people who are very interested in providing evidence-based programs in their schools, connecting to schools and to students. So there's if you're interested in pediatric research and you're interested in sort of care across systems and including communities, this would be a good group to get involved with. Or within your own area of research, thinking about who out there can you kind of tap into and meet on a regular basis, and not only for your own selfish needs for your own research program, but what do you need? What do you folks need out there in the community? So that is the Healthy Learner Collaborative. And now I'm going to turn it over to Kim Nolet to talk about care.
Well, hello, I'm Kim Nolet. I am a research program manager in the School of Nursing, working primarily with Dr. Bowers on her research, and I'm also on the core staff of CARE. CARE is the Center for Aging Research and Education. Hopefully many of you in the room have heard of us. We have been around in current form since about 2012. The roots of the center are actually interesting. Back in the 1990s, Dr. Bowers received a grant from the Robert Wood Johnson Foundation, and I was just thinking of what Susan said there. Maybe the Robert Wood Johnson Foundation is a good place to start if you're looking at developing a network here. Many of these have grown out of that. And the grant was really developed to help speed research evidence in healthcare, particularly around care of older adults, into practice at the state of Wisconsin level. So we had a partnership with the Department of Health Services at the state of Wisconsin, and that really planted the seeds for what is now the center. The center is primarily focused on improving the aging experience for all of us, not just the people who are older now, but those of us who are caregivers and those of us who will be aging in the future. And we really want to develop the nursing workforce. So you'll see 3 areas there which we are primarily focused on. We are in the middle of a new strategic planning process right now. Every 3 years we do revisit our strategic plan, so it's a great time to get involved in the network if you have some ideas. Education is our first area that we focus on, and that is preparing the future workforce to care for older adults. And we've done that through several projects. One is simulations for undergraduate nursing students, which I think unfortunately some of them aren't being used right now, so we're hoping that one of the CARE projects in the coming year will be helping figure out a way to use those again in the undergraduate curriculum. We participate in the National Careers in Aging Week every year, and we partner with the Student Geriatric Interest Group to do that. We offer a few healthy aging fairs every year where we recruit students to go out with other professions here on campus and engage with older adults who are living in the community independently and help them with health screenings and counsel them with some good nursing advice for aging. We've developed a course. Diane Farcetta and Lisa Bratsky really spearheaded this. It was around dementia and aging, and it's an interprofessional course, and I believe that may be offered again next year. It's gotten great reception, high enrollment numbers, so we're really excited about that. In the discovery area, we help support research in the School of Nursing primarily. We do this through creation of newsletter stories. If you are interested in signing up for our newsletter, I'll show you how to do that in a bit. And we've been starting to help a little more with research site recruitment. One of the projects we've just worked on is with Dr. Roberts, helping her recruit nursing homes for a study she is working on. In the practice area, this is really where we've probably focused the most of our efforts over the last 3 years and is most apropos to this colloquium today. And we have done this through creation of workshops for direct care workers, several toolkits that we've created for implementation of evidence-based practice. We have participated in conferences throughout the state that primarily are focused on practitioners, so we've been getting our work out in that way. We've done presentations to several groups. There is a group here in Madison that we've been out to several times to talk about things that are going on in the School of Nursing, and it's a great audience we get there. It's probably about 40 local area practitioners that show up every month at these meetings, and luckily they keep asking us every year to come back and ask what new we have to share. Again, we have our newsletter, we have social media, and we have several established partnerships. I'm going to talk a little bit more about who CARE is here in just a minute, but Diane Farcetta is our manager of CARE, and she does a really great job of continually engaging partners so that it's not that we're only going to them when we need them for, say, a research site or we need a practice site for students. She really looks at how we can give back to these sites and how we can continually engage with these sites. All right, so who is CARE? This is just a sample of them here. So down here in the corner, you'll see our leadership team. It's led by Dr. Bowers, and Diane Farcetta, who I mentioned, is our day-to-day operations manager and keeps us all on task. I am there to help with several of the research initiatives, and Peggy Reinerson, who I'm not sure how many of you have met her, but she works especially on the events that CARE participates in. So why join CARE? We try to have fun and get a lot of work done. So it's a great way to network with other colleagues who are interested in aging. Our CARE network is a very kind of loosely grouped members of faculty, staff, and graduate students. We have started to spread across campus a bit. We're a little worried about getting too large too quickly, so we're kind of treading carefully in that area. But we welcome everyone to join us, and at least when you're on the network, like several others, you get in on the newsletter, you get announcements, and you get opportunities to meet. And then we have an affiliate program, which is a formal affiliation. Faculty and staff and graduate students can fill out a form, become an affiliate, and they have to somehow relate their work to CARE during the year, and in return, they get access to the services of CARE, which can be research recruitment flyer design, it can be taking materials out to the conferences we go to, or it can just be a place to bring an idea that you want some help with. If you want help finding some project funding for an idea that you have, that's something we can certainly help out with. As a CARE affiliate, you also get your work promoted in both the CARE newsletter and social media. We do monthly newsletters that will profile some of the work being done with a particular emphasis on translating research into practice. You can get easy access to campus and external collaborations. As I said, Barb and Diane have done a wonderful job of really cultivating relationships with people working out in the field, and they come to us asking for things, and then in turn they welcome us often with open arms when we come asking for favors. You get to share ideas and get assistance with those ideas. That's sort of how the simulations that we developed came to mind. When people were just loosely talking about ideas about different simulations we could be taking advantage of in the apartment setting in particular. So we found some funding, we found some people to work on it, brought everybody together and brought it to life. And we also have some special events throughout the year. This is also the fun part. We've gone out and done the Alzheimer's Walk every year in Madison, and we have hosted events here in the School of Nursing. I should mention that we are funded primarily by donor support. It supports a small part of Peggy and Diane's salary. The rest of us are all funded on grants, but that does certainly help us out. So we love spreading the word to donors that we're always happily accepting donations to keep our work going. As I said, it's a great time to get involved, whether it just be getting on the CARE newsletter list, and I'll show you here in a minute how to do that, or if you want to join us formally, feel free to stop and talk to Barb, Diane, Peggy, or I at any time, and we can talk about how to formally engage you. We welcome everyone with open arms. All right, so for everybody that you heard about today, this is where you can find our websites. If you go to the School of Nursing homepage and look under the Outreach tab, you'll see a list of all of us there. So if you want any more information, that's a great place to find it. And I did want to thank Tracy and Susan for putting this together today. This was their brainchild to bring these groups together. And if there's anyone else in the school that we have missed, a group that we have somehow missed, please let us know. We'd love to hear more about it. Maybe in the last few minutes we have here for questions today, if anyone wants to bring up any other collaborations that are about translating research and practice evidence into practice, please do bring that up. So I think we can open up for questions now. Does anyone have questions? Please use your microphone if you have questions. Or Elise.
I did turn my mic on.
Oh, there you are. We hear you.
I'm just prepared.
Oh, okay. Do I need to repeat what I just said?
I don't think so.
Okay, thank you.
Thank you, Elise, for...
You're welcome. So again, just really nice to get more detail on the important work and contributions that all of you are making. I had a question for Lori. In your work with the schools, you mentioned, the need for sort of guidance and assistance around mental health issues, and definitely seeing an increase in that area. I was wondering if you might be able to share what sort of, which conditions are you seeing more of, depression, anxiety, or even more serious illnesses?
About 30% of a school nurse's day is spent on mental health issues, so it's a big issue. It runs the gamut. So there's a lot of depression and anxiety, and that manifests itself in different ways. So, students come in with stomach aches, and really what's going on is they have anxiety. But there are very young children who are on very strong psychotropic medications. And I think what strikes me in talking to school nurses, and I just did a focus group in New Jersey with some New Jersey school nurses, and this is the case all over the country. Just some of the things that they're seeing are, really mind-blowing. And there was a post on the School Nurse Net this morning about a student who's just incapacitated by anxiety, and apparently he's had some sort of major trauma. He's like a middle school. And they didn't go into details about what that was, but this kid couldn't get through the school day, so, and there aren't enough mental health providers, so it's really a tough problem. And so school nurses are, the kids are coming into the school health office and they set up things like, you can come in here, this is a safe place, and you can just rest or have a quiet time here for the next half an hour, and they go back to class. Or they're, some of the things we have in e-school care are sort of these short interventions that school nurses can do when you can't get a child in to see a healthcare provider. These are some sort of stopgap, effective, short interventions that a school nurse could do. So, yeah. Yeah.
Other questions?
Anyone have other networks that they know of that they're part of in the area that they want to recommend? All right. Well, thank you everyone for coming today, and all of us hope that we hear from many of you soon. Thank you. Thank you.